Parkinson's Project by Hannah Fliss, Sierra Knowing, Charles Wagner, and Everett Jones.
Hey Doc, my pa ain't been feeling too well lately. He's been shaking.
Hello.
Hello.
I'm Dr. Fliss. Nice
Hi.
to meet you. I'm Sierra. I'm the med student.
Hello.
Nice to meet you. So what brings us in today?
I've been having tremors, slowed speech, tightness in my upper body and my arms, and
His balance hasn't been well either. Lost
Okay.
a lot of trembling and stuff like that, especially in his arms and legs.
Okay.
A lot of stiffness in his trunk as well.
Any changes in speech at all?
yeah, it's been getting slower.
Okay.
All right, so with your symptoms, there are a few things that we kind of can categorize them as. So it looks like Parkinson's would be one of the top things that we'd be looking at right now. And that's a progressive neurological disorder, and that impacts your movement, your central nervous system. So that's the main one we're kind of leaning towards right now for a diagnosis. The other ones would be an essential tremor, which is a neurological disorder that causes your shaking and your trembling of your hand that you've been having. There's also the progressive supranuclear palsy, and that's an uncommon brain disorder that causes serious problems with walking, balance, eye movements, and eventually ends up affecting your swallowing. And this disorder results from deterioration of cells in areas of the brain that control your body movement, coordination, and other functions. And the last one would be multiple sclerosis, which is a disease in the immune system that destroys the protective coverings of nerves and disrupts communication between the brain and the body. And one symptom can be a decrease in coordination, which is similar to Parkinson's and what we've been looking
So
at.
what disease do you think it's most likely?
We are probably thinking at this time that it's most likely Parkinson's. So there's not really any x-ray or blood testing that can be done to diagnose this disease. However, your presence of 2 or more symptoms is what gives this away. Some other testing can be done just looking at bradykinesia, which is just slow movement in the limbs, face, and while you're walking, which you did display when you walked in. A tremor, which is what you have. This is typically a resting tremor when you're sitting down, and it typically stops when you're up and moving. And a positive response to Parkinson's medications, and a positive response would be a decrease in your symptoms, such as the trembling and stiffness.
And if it is Parkinson's, what do we do from here? So what causes Parkinson's exactly?
Yeah, so Parkinson's is really from the substantia nigra, which is part of the basal ganglia and is located in the midbrain, which is the topmost part of the brainstem. The substantia nigra is gray matter within the midbrain that is responsible for the production of dopamine, which can impact areas of the central nervous system such as movement, control, and cognitive functions. And dopamine is the neurotransmitter that plays a role in movement, memory, and reward. Dopamine works with other neurotransmitters to help coordinate movement. So that's why we're seeing issues with the slow walking and the trembling. And in Parkinson's, there is a lack of dopamine resulting in lack of balance, tremors, slowed movement, and impaired balance and vision.
All right, so I'm very concerned about my pa. What are the risk factors for Parkinson's?
So since he is in his 60s, this is most likely what it is, and it is more common in men, so that's apparent. And Parkinson's is hereditary. Is there anyone in your family, in your bloodline, that has had Parkinson's?
My dad had Parkinson's.
Okay. And pretty much any exposure to toxins like herbicides and pesticides could have led to this, so that's kind of what we're looking at.
So what can we do to decrease symptoms?
So there is no cure, but there are various ways to decrease your symptoms and slow the progression of it. The first thing would be medication, and the most commonly used one is levodopa, and that stimulates the cells left in the substantia nigra to produce more dopamine.
And then there's also a couple of surgery interventions that we could do. Of course, that would be in a more serious case, so we're definitely not looking at that at this point. So there's 3 different kinds. The first is a thalamotomy, where doctors purposefully damage part of the thalamus to interrupt some of the neural networks that may be causing symptoms. The second kind is a focused ultrasound, which is a non-invasive procedure that uses small beams of acoustic energy to damage targeted areas of the brain to relieve symptoms. During this, the patient is awake and wears a helmet called a transducer. Specialists will use MRI to help guide the energy beams to target the corrected area that they're trying to damage. It is a non-invasive treatment, but is only used to treat tremors right now. More research is being done to test the accuracy of targeting other areas of the brain to relieve other symptoms, such as like slowed movement or speech. And the third kind of surgical intervention is called DBS, or deep brain stimulation, which is the most common surgical treatment. It utilizes electrodes that produce an electrical impulse to the deep parts of the brain using the thalamus, subthalamic nucleus, and globus pallidus. And it helps rebalance control messages in the brain, suppressing tremors and decreasing medication doses.
And the last thing we would be looking at for treatment would be supportive therapies. So that includes your diet, exercise, physical therapy, occupational therapy, speech therapy. The exercises we'll be working on balance and coordination can help to slow the progression of Parkinson's by maintaining the neural connections within the brain for longer. And all of these help to enhance your quality of life and decrease symptoms by increasing mobility, flexibility, strength, coordination, and cognitive processes.
Over 1 month later.
So how is that levodopa working for you?
It's working out really well. I like it.
All right, and what about physical therapy?
I feel less tight. I feel a lot better. My movements have been getting a lot smoother.
Okay, good, great, that's good to hear. So I think we'll just keep you on the levodopa for now. Keep going to physical therapy as normal. We'll follow up in about 6 months and go from there.
Sounds good.
All right.
Thank you.